Hi, my name is Professor Colin Talbot, and as the COVID-19 virus sweeps around the planet, how are governments coping with this crisis? What's worked and what hasn't? These are some of the questions that we'll be asking during a series of interviews with government and public administration experts that I'm going to be conducting. Um, Today, I'm going to be talking to Clay Westcott, who's got some very useful international perspective on what's going on at the moment. So, hello, Clay. Good to see you again.
Hi, Colin. I'm Clay Westcott. I work as a consultant with international financial organizations like the World Bank, also the president of the International Public Management Network. I'm not working on the front lines of COVID-19 right now. I'm under lockdown in Naples, Florida, but still following events very closely.
Thank you, Clay. So I think probably if we could start with something about your experience when you were at the Asia Development Bank with the SARS outbreak.
Yes, well, in 2003, we had the SARS outbreak. It first came out of Hong Kong and then infected a number of Asian countries and even places like Toronto, Canada, were under lockdown for a while. So I was working with the Asian Development Bank to see what kind of measures we needed to take to carry out our business during this SARS outbreak, and it was very challenging for us, but we managed to do it. Of course, the SARS outbreak, although it seemed like a catastrophe when it happened in 2003, was really quite mild compared to the COVID outbreak that we have right now, where the infection rate is said to be about 10 times higher than the infection rate for SARS, and also the fatality rate is much higher.
But I think there were some interesting experiences from that, some lessons that were learned by the Asian Development Bank and by governments in the region.
Yeah, well, I think mainly we saw that governments learned that it was very important to take steps for preparedness before one of these pandemics took place. So that meant to have an institutional structure in place so that you could respond both to the health challenges and the economic challenges. So on the health side, make sure you had things like face masks and ventilators and equipment in place, but also that you had an institutional structure to manage all of that and to be able to roll it out quickly, because these viruses proceed very quickly. So I think this is one of the reasons that we're now, some years later, seeing a number of East Asian countries perform much better in containing the virus than other countries around the world, because they had that experience with SARS and then with subsequent viruses, unfortunately, many of which originate in Asia, like the Middle East syndrome was another one that they had to deal with.
Has there been any obvious differences between any of the East Asian countries in their level of preparedness and how they've actually organized government to deal with the outbreak?
Yeah, well, I think, I mean, there are various differences, and of course, some of the countries have been much more successful, particularly Singapore, which has a very effective and high-tech contact tracing system that they've been able to roll out. Taiwan has been very effective. I think one of the measures that they used with great success was careful screening of passengers coming in on flights from China, particularly flights from Wuhan. They did this very early on. And, they actually had their screeners come into the airplanes and interview people, test them, and so forth before they let them off the plane. I mean, just by contrast, I was reading about the U.S. that since the beginning of this year, 440,000 passengers have been allowed into the U.S. directly from China on flights coming from China, and many of them have not been screened at all. So this obviously explains, problems in the U.S. and unfortunately some of the other Asian countries as well have not done the heightened levels of screening that they have done in places like Taiwan. Another case I think that's worked very well is Korea, and there I think the big thing there was the testing that they did. Now they've tested more than most other countries earlier than most other countries, but they only had to test about 1% of their population. At least that's what they've done so far, which is comparable to what France and Germany have done today. The thing about Korea is that they did it quickly, and the European countries waited longer, and therefore, have had much more problems to deal with.
You've got a fairly unique perspective as president of the International Public Management Network, and I just wondered if you had anything to say about that and the way in which public administrators around the globe are cooperating with one another.
Yeah, well, I think, I talk with a lot of people, both members of the organization and also people that I work with the World Bank and the Asian Development Bank. And they are very interested to learn about what is going on in other countries. The challenge is that, you can be aware of what's going on in other countries, but your country, whatever it is, may not be able to do the same things that are being done in Singapore, Taiwan, and Korea. And so that's been, I think, a big challenge, especially for the low-income countries. I mean, which are the ones that I mainly work with. These countries have very weak public health systems in many cases. They have a high proportion of informal sector workers. In Africa, some estimates are that maybe 90% of the workers are informal. So this means, if they don't go out to work, there's no safety net for them whatsoever. And so there's a real disincentive for them to stay at home. There's also been a huge decline in remittances in these developing countries and tourism receipts. And then corruption is a big challenge. Of course, it's a problem everywhere, but in developing countries, more so, both corruption within the health sector on procurements, on having to bribe the doctor before he'll see you, but also corruption at the political level, where political leaders may respond to the crisis in a way that best suits their personal financial interests and undermines the effectiveness of the response. So, as I say, I think the kind of information sharing that goes on in the International Public Network and through the networks of the World Bank and other organizations is extremely important, but decision makers need to be very careful about taking this information and adapting it to their own conditions.
Yeah, I think that's very true. Can I just go back to one point just to clarify for our viewers in case they didn't understand? Could you just elaborate a little bit on that point about remittances?
Yes, well, of course, there's been a lot of work on this over the last 20 years or so, and we now know from pretty robust estimates that the value of funds that are transferred to developing countries, especially to low-income countries, by remittances far exceeds the total amount of official development assistance from the World Bank and the various development partners. And not only is the money value much greater, but the money is much better targeted because it goes directly to the families of these people in most cases. And so there's no middleman taking money out. I mean, except for maybe Western Union, although even that has been improved drastically so that there are much less expensive ways of getting money from the places where the workers are working to their families. Unfortunately, the COVID-19 crisis has really turned that system on its head. Many workers that were earning good incomes in developed countries and in emerging market countries have now lost their jobs. And so that means they have nothing to send back to their families in developing countries. So this is a huge shock to the economies of countries like the Philippines, like Bangladesh, like many parts of India that rely on this remittance income for basic food and services for many of the families in these countries.
Thanks, that's very clear. Thank you very much. Just one final question I wanted to ask you about the levels of government response, in the sense of, obviously what we get reported internationally is mainly national level government responses, but I get the impression from some of the East Asian countries in particular that a lot of the response has actually been both national and subnational. There's a lot of work and coordination being handled at local levels. And particularly I saw a report from China that said, contrary to what you might expect with a highly centralized state like China, that actually a lot of the response had been very localized to cities and regions. I just wondered whether that you'd come across that issue at all.
Yeah, well, of course, I mean, that issue has pluses and minuses that are attached to it. But, certainly in China, the main focus of the attention by the government was in Hubei province, and particularly the city of Wuhan, because that's where it all came out of. And so there was a huge amount of attention there, and that was helped China to eventually make its effective response. Of course, there were great delays in China, which were a problem too. But this kind of decentralized response can also be a big challenge. And I see that firsthand right here in the United States, where we have a relatively weak federal government response. I mean, it's been strong in terms of fiscal stimulus and monetary policy, and to the extent that there is expert and scientific work going on this. A lot of it is done at the federal level through the CDC and other kinds of federal institutions. But most of the actual response in terms of lockdown, containment, testing, and that kind of thing is being organized by the state governments and even the county and local governments. And this is a real challenge in the United States because, of course, people move all over the country. And so if you can be from a state that has a very tight containment policy, but then somebody from a state with a much looser policy can just drive into your state and affect your people. So I think that this is something that other countries will hopefully learn from our example in the United States. Of course, there are advantages that some states are doing an extremely good job at containing things, and this is good, and they can kind of set an example for other states to follow. But the disadvantage is, because of the way this disease moves around, there are additional risks that are caused by a decentralized system.
Yeah, thank you very much for that. That's one of the things I'll be following up in one of these interviews later, where I'm going to be talking from the devolved administrations in Scotland, Wales, and Northern Ireland, who've had slightly different experiences in responding to this. But like you, I'm afraid Hadrian's Wall and offers don't act as barriers anymore between the main countries, so people can just simply move around the country. That's been fantastically useful, Clay. Thank you very much. I will almost certainly be coming back to you if this thing drags on, which it looks like it's going to talk to you again with your unique international perspective on what's going on. And I hope you'll be able to follow what we're doing in terms of talking to people in other countries. The next one's up are Canada and Australia and the US in the next week or so. So they should all be online fairly soon. So thanks very much again, and I'll probably see you soon, and keep well.
Great. Thank you, Colin.
Thank you.